Government's decision to close the economy at the height of COVID-19 pandemic was bad news for rural Binga. Villagers who survived through selling organic chickens, fish and goats to traders who in turn supplied to the sprawling Victoria Falls hospitality industry were left stranded. Binga has little rainfall, and for ZONDANI MUNKULI, an elderly visually impaired villager who harvested only 20 kgs of sorghum last year, life has become harder. She has received her first jab, but the second one remains elusive. She has to wait for the mobile clinic to come to her area, but now she is worried because it is way past the stipulated waiting period. Her only source of information is hearsays from neighbors. The clinic is 15 kilometers away from her homestead. But without any reliable source of information in the language she understands, ZONDANI is a victim of misinformation, which often leads to vaccine hesitancy and resistance. For Lonika Munguli, who has difficulty in walking, repeated visits to the faraway clinic that only materialized in her finding the vaccine out of stock and consequently demoralizing her. As a result of this collusion of factors, the marginalized in marginalized communities are the most vulnerable to misinformation. Community leaders in the area have been advised by the government to improve coverage of COVID-19 related issues in minority languages like Tonga.
To journey information through my phone, to send my phone, kana ma WhatsApp, kana kuti bamwe bantu bendenda batwetera information kuti kuli COVID. Then mwede kuchita abo mwede kuzwata kunana ma sanitizer, kuzwata ma mask, kusamba edota, then akukala kutatana social distance. Then ndede kuti ndambire muchikuwape kutantana kukala tatujatani mumaboko tatinojuziani katujuziana kupera ngaturi ku mwapona byeni tuindana muboko. So njo information ni chana pao kuti tujane izizwide bamanisi bali kule kuti tubuze abamanesi ngabalanonoka kuzosika so ngatulabu yumyumwa kuti kuti twijana information twijane nakule
insonda nkuzizwa nkule kwasyanzyondo ndabona kana ni 5 km kuti ndiende mengana sikwanisipe pesinda kinka imiya kazida afifi gukumangani ndakakubola mansiku ndakakuyaswa wani manje yeye chiviri lino ndaleta kuti ndiyaswe ndakaswa mu 15 ndikede kopera ndabula kuti ndiye kwasyanzyondo nkule kwasyanzyondo kulelo kosivili
azikide bantu kumangani mbulinde mene silikonze zindamba bya tayengona kinkidaye pen siyasidwepe twavuga umatekira ategwa na ulabulwa zwe bipi tabwechero tabiyaswape na uletumbuka na ulamana tabwechero swetula amalwa ze bipi akayobo kutamwi chonzi ombombo kuti tabiyaswe akubula siku nyampuka mbuli mbondo obuno
echichirwazi tuli kuchimva mbubobo kupera kuti kuli chirwazi chilobo kubatabirizi twakachitituyo meeting kuti kuli chirwazi chilobo chanda kuti musambe umabobo mubige tutomu kumilomo musambe nsipa so mbombubo kupera batita chinatu sigera peto bamwe
ndamvuga onse bia olunjiyo chindebe ndamvuga kwambula kupera ndamvuga nibambula ndamvuga kuti ichitwa soso musambe mube kilini amubirenu amusambe nsipa zyonse amukolele munjo zyonse tuli ndi kuzimvuga mukati mu radio amubantu bali mugwambiriza abantu
kuti batulangira nsinga batubesizya muchindebera muchishona muchitonga so tianda kuti twangwisizya so muchitonga cheso
tinasibona hazati lapha kungcono ukuthi sibe le TV lathi umbeni le radio kwenzela ukuthi sibe sizwa konke kuyabe kusenzakala njengakhathesi siyabe sisizwa nje okwe corona from ema clinics kumbeni kuma village health workers ngabe so silama TV kumbeni ama radio besiyazizwela nje lathi ukuthi uhamba nje
wakayaswa iye wani yechituti nasikape matavizi vazotuzivya avamwe vakazide vazotupansika to vamwe twakazopekwanzika kuti katusambya ezyo pawo wazowambwa date kuti valasika vazoyase so twakazonyankuka wakuyaswa so kusiyali deli wani kuti wakavuzibwa kuvatavizi
ya ndakitola ndakijana ku clinic po ndayijana ku bantu ndayijana mugwe obumvwa mbubobu mugwe obwenda ndakimvwa ndasi kuti ndichirangiriza mbichani ndabona kuti kwaba kwa mazuva ndikayaswe injection.
Challenges we are facing now is the way the free donation from China. I think the perspective people have on China have got a negative attitude. Something, and if you say something this is free, something that is free is not worth. So when they say it's free donations from China, people there are different connotations, and they think or feel China is not a good friend. So I think the way associated with free vaccine from China made it impossible for people to voluntarily go for vaccination. That information is circulating on the social media from WhatsApp. So the government needs to have more programs, awareness campaigns. They come to us, traditional leaders, then we address our people. Of course, we can only address our people if we are happy. So they need to organize better workshops. Then in turn, we also organize better workshops that we cascade the information.
Tungati kuti kwasebenziswa Econet inline irajata pawo kwasebenziswa kuti bonse bantu baba pegwa mafoni ala ma WhatsApp kuweza kuti titeni tujane information ili right. Then kwakuti kuendeleze kwakuti kata kwe network but chipati Econet irajata. So that network irajata pawo kwa mafoni ala ma WhatsApp kuweza tujane information ili right.
I think first and foremost is awareness campaigns. You need to come up to the people. The traditional leaders we were addressed by the district committee. We are even being addressed by the health personnel. We always attend Yama meetings every month. So we are being taught, we are told, we are informed. And for us, what was left now, it was because there were hindrances that we were not supposed to meet gatherings of not more than 20 people, so forth. But now, since those restrictions were waived off, so I think now we are going to the people. Of course, it's us who encourage them to get vaccinated. Then we even requested the health personnel at the nearest clinic, Siansundu Clinic, to have mobile clinics. That's when they come to the people. Because you said, since you are saying, the elder are the most vulnerable, so they cannot travel long distances.
Pempa nkokugwasigwa kwangu anguwa bulwazi kuti anoli kuti bulizengere kuti bozabyeni kose ne balakozya utugwasya na mapilisi kana nenzi kana musa muli byeni bayezya kutugwasya mbuli ikunga kwetwa mapilisi a malaria atensi bayina abulegaya.
So the government needs to have more programs, awareness campaigns. They come to us, traditional leaders, then we address our people. Of course, we can only address our people if we are happy. So they need to organize better workshops. Then in turn, we also organize better workshops that we cascade the information. I think you need to print flyers, newsletters, which are written in the language, Tonga language. And I think this is most important in the government. It helps through their national FM. This is the broadcasting cooperation. They give more time to indigenous languages. At least people may get that information. Unfortunately, they are saying equal opportunities. Of course, we know the Tonga program maybe 30 minutes a day, so it's not much. I think the newsletters and the newsletters should be written in Tonga, flyers and so forth. The national broadcaster should do more in local languages.